Hi, I'm Dr. Vick from Elite Chiropractic. Today I'm going to go over how to treat plantar fasciitis. I want to work through the entire lower limb and open up that entire posterior chain. A lot of times you'll get tenderness in the plantar fascia from repetitive use type injuries. Running is a big one, increasing training over a short period of time, going from a little bit of training to a lot of training. Oftentimes it can be footwear as well if you don't have proper arch support for the bottom of the foot. Many things can cause plantar fasciitis, but what we want to focus on, one, treating the plantar fascia itself, and two, working through the calves especially and loosening up that whole posterior chain as I mentioned before to help unload the tension in the plantar fascia, as they're all certainly connected. So first, as we work through the plantar fascia, the best way to do this is to use an instrument. In this case, I'm using rock blades tool. A lot of times in plantar fasciitis, the tension will be where that plantar fascia attaches right at the base of the heel. So we'll work through that spot first. You'll feel kind of a grittiness as you work through that scar tissue in that specific spot. Then we'll start to fan out and treat the entire plantar fascial surface through the arch of that foot. Treatment option wise, we're going to tape at the end after we've done this, again to help unload the tissue and allow it to heal, so that as that fascia attaches to the bone, it can heal up and not be as inflamed and tender. A good solution is to get a proper orthotic that has good arch support, which depending on your foot type will be different, whether that's a rigid support or a little bit softer support. But getting proper footwear, proper orthotic is really important in treating plantar fasciitis. Really just addressing the tissue problem in its own will help temporarily, but long term, many times it's a mechanical issue or a training issue, so I have to address those things as well. So after we've scanned through and worked on the plantar fascia overall for probably 5 to 10 minutes in total, we'll work through the posterior chain of that calf and unload the tension through there. A lot of times I'll graston through there or use the rock blades or do a pin and stretch type activity where we're pinning that muscle down, putting that through a full range of motion to try and loosen up that calf and the posterior chain. Again, in the end, we're just trying to loosen up tension in the plantar fascia since that's specifically where the pain is at, but we have to address all of the mechanics in and around that as well to get effective treatment. After we've done that, I'll use a little bit of cryoderm to clean up that surface and the emollient that I put down so that the tape will stick. I'll cover that area with emollient. I like to use cryoderm. Wipe that off, clean the oils off there a little bit so the tape will stick. We're going to stretch the tissue and then lay the tape down with relatively little stretch on the tape. We're going to follow that pattern from the forefoot up into the calf, and then put a little bit of an anchor strip on the base right where it attaches the heel as well. So I'm going to stretch the tissue, have her put her toes in flexed position there. Start at the ball of the foot, lay that first couple inches down, put a little bit of stretch right over the plantar fascia, and lay that down with a little bit of stretch over it, and then the rest down with no stretch. Heat that up a little bit so that it sticks. I'm going to put one more piece right at that insertion point so that we can unload that as well. I'm going to stretch it right in the middle here and then anchor it on the outside of the foot and then pull tension up just to give that arch a little bit of extra support and unload that point where it's most frequently tender as well. This is a very effective way to treat plantar fasciitis. As I mentioned before, a lot of times you'll have to add an orthotic to this or perhaps a more rigid taping as you're trying to work through that acute phase. But overall, this is a great way to get that healing started and get you performing better. I'm Dr. Vick, Elite Chiropractic. Thanks.